Jessica González-Rojas is running for state assembly, which is challenging in its own right. But when the pandemic hit, things got even harder. But González-Rojas has taken it in stride and used it as an opportunity to help others.
Hi, my name is Jessica González-Rojas, and I'm 43 years old, and I live in Jackson Heights, Queens. And I actually am a candidate for the New York State Assembly for the 34th Assembly District, which includes Jackson Heights, East Elmhurst, Corona, and Woodside. And previous to that, I've been running a nonprofit organization focusing on public health, women's rights, and Latinas' access to health. And it's interesting because when I first decided to run, I was thinking about the hurdles before me, leaving a job that I love, balancing having a young son, an 8-year-old son, with the responsibilities to go to Albany, whether I could raise enough money, whether I'd get, whether I win. It's a big risk. I had to quit my job to do this race. But never in a million years did I have to wonder whether there'd be a global pandemic that would strike in the middle of this campaign. I had to ask myself that question on Wednesday, March 11th. We were in the middle of petitioning, trying to get signatures to get on the ballot. And by Thursday, it was very evident that this was a very, very contagious virus. It was very dangerous. And I did not want to put the health and safety of my volunteers, of the public, of myself at risk. And as someone who cares deeply about public health and expanding health access to everyone, I had to make the hard decision to suspend petitioning. At the time, we thought we were suspending it just for a moment, right? Or just for a few days, a few weeks. But it became very clear that this needed to stop. And it was a risk because that could have meant me not getting on the ballot. But as the cases of coronavirus started increasing and we started seeing deaths in New York, it became much more scary and much more clear that as a campaign, we needed to shift from what a traditional campaign would do to supporting those in need. And we immediately shifted to doing mutual aid calls. We did phone banks every night. We're still doing phone banks every night to check in on our neighbors, on seniors in particular, to see what is needed and how we can connect them to resources or essential items. And it's been hard. It's been hard making those calls because people are asking for some of the most basic things like access to food, medicine, toilet paper. I actually was able to deliver toilet paper and soap to an elderly couple a few blocks away. And at the time, I didn't have a face mask because I didn't want to take that away from essential health personnel. So I wrapped my face in a bandana. I did have rubber gloves in my house. And I went to their building. I rang their bell and ran down the hall because I wanted to stay within the 6 feet distance. And they opened the door, and thankfully I didn't scare them. But they opened the door, they waved to me from down the hall to let me know that they got their items and that they were really grateful for that. And that's what we've been doing. That's what we've been doing is calling folks and connecting them to resources. And as the days have gone on, the needs have been greater. It's been much, much harder to do this work because the food insecurity is real, the lack of access to medicines, the inability to go outside, the concerns about making rent, and whether they can stay in their homes is very real. While this is certainly not the campaign I thought would happen, it's certainly allowing me to rise to the occasion of being a community leader, and that's very humbling. As someone who cares deeply about the community, it's been really, really important to connect in this way, in this moment. And not only have we shifted to phone banking, we also moved from what we would have done around like town halls and issues around that we were presented in a town hall format. We went to move towards a virtual town hall format. And we've touched on topics such as the coronavirus itself, mental health, cooking and making delicious food with what you have in your pantry, rent and know your rights for tenants, and other issues that really impact the community. So here we are. I'm just a few blocks from Elmhurst Hospital, in the epicenter of the epicenter, and I tragically hear sirens regularly, ambulances going by, and it's heart-wrenching, but I know our community will pull through. I know that we're resilient. I know that it's actually showing the beauty of our community. We're pulling together, we're helping one another out, and I know we'll get through this together. So thank you for listening to my story.
That was Jessica González-Rojas.